Hi everyone, welcome to NU 222. This is Health Restoration 3, so this is for the 4th semester APU Clinical for Trollcare College, and I am your clinical instructor along with Dr. Richard Malham. My name is Lindsay Porter. I'm an MSN FN board certified family nurse practitioner. So I just wanted to welcome everyone and welcome to your final semester of nursing school. Certainly an exciting time for all of us. My name is Lindsay Porter. I'll be your clinical instructor here at Kenmore Mercy Hospital, Buffalo, along with Dr. Milham. First, I want to take a moment to recognize how far you've come. You started this journey learning the very basics of nursing care. You've also transitioned from long-term care to acute care. You've built your knowledge and skills and pushed through some very challenging semesters, so congratulations. Now, here you are, your final semester, so this is certainly a milestone worth celebrating. It's also time to focus because this is the bridge between being a nursing student and becoming a registered professional nurse. By now, you should feel pretty comfortable walking to the hospital, taking a patient assignment at the beginning of the shift. As you guys have already been in the hospital for 2 semesters, so the acute care setting is pretty fast-paced, definitely unpredictable, and filled with a lot of patients who have many simple and also very complex needs. So this semester you'll be at Kenmore Mercy Hospital, a great facility, a magnet facility. You'll continue to care for patients across multiple units, medical, surgical, telemetry, oncology, post-surgical, and also critical care. You'll see firsthand how teamwork, communication, and critical care all comes together to make safe, high-quality, evidence-based patient care possible. As your final semester students, you'll be expected to step into a more independent role as a student nurse. That doesn't necessarily mean that you'll be completely on your own, but it does mean that your instructors and preceptors will have higher expectations for you. My educational background, I received my associates in nursing from SUNY Area North Campus, my BSN from University at Buffalo, my MSN from Roberts Wesleyan University in Rochester, New York. I'm a board certified family nurse practitioner by the ANCC board. I'm a New York State Nurse Practitioner Association member. I'm ACLS BLS certified. I've experience working in BMT, urgent care, float pool, CVICU, med-surg telemetry, and cardiothoracic surgery. I've worked as an RN at Cleveland Clinic, South Buffalo Mercy Hospital, Rochester General Hospital, and University of Rochester Medical Center. Currently, I am a clinical nurse educator for the med-surg nursing at Catholic Health per diem. So setting professional and clinical goals are super important, especially as you guys are approaching graduation come in December. So there will be some professional clinical goals that I want you to set for yourself. We'll discuss those in our first 2 post-conferences and pre-conferences. These skills can be knowledge-based, skill-based. Maybe you want to be more proficient in administering medication, doing head-to-toe assessments, recognizing and learning how to trend labs and connecting them to the patient conditions and care. You can also improve your time management before, becoming more confident in giving reports, strengthening teamwork, delegation skills, also joining professional membership or professional organization as well. This will kind of prepare you not only for your current nursing position as you get through the semester and then apply for your nursing license or grad nursing license, but also to prepare you for your first job as a nurse as well. So we'll discuss briefly the clinical judgment model. This is something that you really need to make yourself very familiar with. This is the heart of nursing practice. It's just not enough to just simply perform the task. You also need to have a very good understanding of why you're actually doing things and when you need to do things when patient changes occur. The model helps you recognizing clues, analyzing cues, prioritizing hypothesis, generating solutions, taking action, evaluating outcomes. This is the framework that new graduate nurses use at the bedside every single day. The more you practice it now, the more confident you'll be as you enter your professional role. So Maslow hierarchy, needs remains one of your most powerful tools for prioritizing patient care. Physiological needs, your airway, breathing, circulation, those are always going to come first. Next comes safety, fall prevention, infection control, medication safety. The NCLEX and your test in school are going to not only assess your knowledge, but also your ability to apply what you're learning to other concepts, because not every patient is going to present the exact same way. Only after those are all met can you fully address, psychological needs and like belonging, esteem, or emotional support. Critical thinking is needed. This is what's going to tie everything together. Every patient that you care for from day one until you finish your nursing career will have multiple needs all at once. This is what transforms you from a task-oriented student nurse into a thinking, reasoning professional nurse. So from my understanding, your first general concept that you will be tested on for the semester will be hematology oncology. Those who have had me before know that this is one of my favorite topics. So if any point you have any questions or need any help understanding this concept, please reach out to me. I love hem-onc. So some key concepts you'll want to understand: anemia, sickle cell, clotting disorders. You should be able to recognize abnormal labs like hemoglobin, hematocrit, platelets, and white blood cell counts. And then also you want to monitor for signs and symptoms of bleeding, infection, or poor oxygenation, knowing local symptoms and also systemic symptoms as well. For oncology, common cancers you'll see include breast cancer, lung, colorectal, leukemia, lymphoma. Treatments like chemotherapy, bone marrow transplants, radiation, all of those can have serious and significant side effects: nausea, fatigue, immunosuppression, neutropenia, and also graft versus host disease. As a nurse, you'll monitor closely again for infection, managing symptoms, providing patient care, and family education. Be sure to have a good understanding of oncology emergencies such as sepsis, malignant pericardial effusions, febrile neutropenia, tumor lysis syndrome, superior vena cava syndrome, and cytokine release syndrome. Caring for hem-onc patients require not just clinical skills but also emotional intelligence, so listening is just as important, supporting and being present for patients and families during a very challenging time. I'm not going to spend a lot of time speaking on this, but there are some great professional nursing organizations that I think are great for networking. They offer dinner presentations and also other events and webinars, and you can get CE credits for them. I have them listed here. If you have any questions about any of those, please let me know. They also do offer a lot of clinical resources, journals, and student discounts if you're still joining, if you're a student nurse. So definitely check these out. Applying for jobs, super important. So you're in your final semester, you can start applying early. Many hospitals, they do have new graduate residency and transition to practice programs several months before graduation. So a big thing that you need to decide is if you want to start right away and practice as a grad nurse, or if you want to sit for your boards and then apply. Just know the earlier the better. You will have more options open to you if you apply sooner, whether that's a day shift position, a night shift position, if you want to work in a clinic, if you want to work in a doctor's office or in the hospital. Traditionally, the hospital, you are working 312s unless you are kind of in a PACU, ASU surgery position, and sometimes you will be offered the 410s. It just kind of depends. So those are things that you need to ask. What's the schedule? What's the expectation? Do you have to cross-train into other areas? Are you required to float? Things like that. If you don't have your license yet, you can apply as a graduate nurse and update your application once you pass the NCLEX. Getting a head start will ease the stress of graduation. You will be stressed out either way. It is definitely quite the learning curve when you are starting a new position. Here's some benefits to obtaining your BSN. It is harder the longer that you wait, so I do think that keep your momentum, your educational momentum, even if that's part-time while you work full-time, or the opposite, going full-time while you work part-time. Apply to a BSN program before you graduate. Definitely do that. Again, if you need any help with looking at programs or want any help with any other career options that you can do with your RN, please reach out to me. I'm more than willing and willing and able to help you with that and guide that. So yeah, career advancement, job market competitiveness, educational momentum, and a lot of employers are wanting nurses to be already in their BSN program or obtaining their BSN within 3 years of graduating. So final semester together, I want to leave you with this. You've worked extremely hard to get here. Pull everything together: your knowledge, your skills, your confidence. Set meaningful professional and clinical goals to guide your growth. That's the expectation. Apply to jobs early. This is your last step before becoming a professional nurse. It won't always be easy, but I can tell you, you will be ready. I'm excited to walk with you and Dr. Mileham through this semester, and I can't wait to see the nurse that you become. Please embrace the challenge of learning from simple patients, complex patients, especially in areas like hematology and oncology, where your role as a nurse can truly make an impact and change lives. So welcome to your final semester at Kenmore Mercy. Let's make it a great one, and I will see you Wednesday morning in the lobby.